Good afternoon, Dr. Quo. Thank you for taking time to come and when you're spend time out of your out of your clinical day to sit down and do an interview with us in our Awake Sleep Apnea Portrait Profile series for the month of this September.
Oh, Adam, I'm thrilled. I'm thrilled to be able to support you. You've done so much in creating public awareness and how you've pushed the forefront farther. So any way I can help them.
Well, you've been a tremendous advocate from nearby when my daughter was first diagnosed and we started going through the multidisciplinary interventions and treatment plan, and from 3,000 miles away when we can find some dentists and orthodontists who actually work with us. You've been a great resource. So, that says a lot about healthcare that you don't see very often today in this day.
Happy to help in any way I can, Adam, for sure. Yeah.
Can you tell us a little bit about your background as far as in the dental world and then the sleep world, and then how you're at UCSF and Stanford? Those are all I think that's what makes, besides being the go-to person for CG.
Well, I did my undergraduate education at Northwestern in engineering,
Right.
and I had always planned on becoming an orthodontist. I did a specialty in biomaterials, and so then I trained at UCSF, and I decided to stay at UCSF for my orthodontic residency. And I was interested in orthodontics in the kind of the technical aspects of treatment, and I really just kind of stumbled upon working in the realm of sleep disordered breathing.
How did you stumble upon it?
Actually, through a patient. So I had a patient, I think my second year in practice, and we are planning on doing jaw surgery for this patient, and he kept falling asleep in the chair. And as you know, orthodontic appointments are not that long. And so I was a bit worried. So I asked him to get evaluated and get tested. So during his sleep study, he desaturated to like 63. And so his diagnostic sleep study then became a titration sleep study. So they put a CPAP on him for the rest of the night.
Right.
And so at that point, then the urgency was to try to really get him ready for surgery. And so his treatment plan changed from just doing one jaw to then doing two jaw. And that was my foray. And then that's actually how I met CG.
And at this point, was CPAP being introduced, or was that not even an option?
Oh, no, he definitely was on CPAP.
Okay.
At that point, from that point until surgery.
Okay.
His cardiovasculars were really high because he desaturated so low.
Wow.
And his sleep apnea was very, very severe. So
That drove you right to Dr. Gimeno and the Stanford Sleep Center.
So in talking with the surgeon,
Right.
so surgeon Casey Lee,
Okay.
so we started working together with that, and
That's an everyday surgeon.
yeah, I know, one of the world's best.
Right.
And I told Casey that I wanted to learn more about it, and he said, well, let me introduce you to CG, and he's looking for an orthodontist to work with. And so I met CG, and he asked me to give a lecture to the fellows. And so I gave a couple of lectures, and after I had given a couple lectures, he asked me to continue giving lectures. And it was CG's dream to have this multidisciplinary clinic. And so he had asked if I could participate in that multidisciplinary clinic where they have all different specialties, and the patients come and are evaluated by everybody as a team. And so soon after that, then they gave me an adjunct position at Stanford. At UCSF, because of my engineering background, when I was a first-year resident, actually when I became a second-year resident, they asked me to teach biomechanics and biomaterials to the first-year residents, which is very easy if you're an engineering major. So I started doing that my second and third year, and then when I graduated, they actually gave me a position. And so I've had that position for, I think, maybe 24, 25 years now. 26 years, yeah. Yeah, good. But for a while. Yeah.
So as you know, and I don't know if you remember, but I was originally diagnosed at UCSF correctly, and I was put into a split study because I was so severe, and the next morning would change my life because I saw what the value of CPAP was and the difference my brain worked, and whole other story that I had to wait 2 weeks to get a machine and insurance. It's one of our advocacy points that we'll be dealing with, along with the 4-hour rule and the 70% and all that.
That's fantastic.
Yeah, we now have the survey data from this meeting that we did with the FDA to go to CMS and say, this is the real deal. This is what's going on. These patients are not being missed by a year or two. It's decades.
That is going to be very powerful, very powerful. And but other than CMS and the Medicare system, there's other independent healthcare systems.
Absolutely.
So one by one, yeah.
What we've learned is that once CMS sets the standard,
Mhm.
everyone else falls into place.
Hopefully, yeah.
We've-
That's fantastic. If anyone's going to make the change, you're going to make the change.
We don't have a choice, as you know. I'm not here because of the system. I'm here in spite of it. And, you know, it gives me the confidence when I walk into any other sleep researcher or doctor that, you know, when I see my daughter, I go, if she would have walked into your office, I don't think she'd be here right now. And that's a scary thought for us, you know, for Justine and I being the parents. I don't want my daughter to be the exception. I want her to be the rule. So that when any kid does present to a pediatrician or primary care physician or family physician with ADHD or failure to thrive or autoimmune issues or always sick or temperamental, that we start to include the sleep evaluation as part of the full picture. As you know, in med school, you know, sleep deprivation is the badge of honor. This is the way we were all taught. How much could you do on as little sleep? And it's the antithesis.
I think that there is something that is really that most people don't quite understand. People like you, thankfully for you, your life, your income does not depend on what you're spending your life on.
100%.
As a result of which, the bias that you have is totally minimized compared to most healthcare professionals whose income depends on what they do. And as a result of which, I think that you're much more able to move the system forward than many people whose income depends on how they do things, and they don't want to change it because it's very scary. To change dramatically.
Oh, there's no doubt. One, couldn't hold a job, and two, if I didn't come from a family of means, I'd have been dead or in prison a long time ago. That's a fact. I wrecked more cars than I can even count at this point. Now, this is why did I keep getting cars?
Of course, the patient we heard today,
Yeah.
says basically the same. No
Yeah.
means, no surgery, no life.
Right.
So, which brings us to an interesting conundrum with the sleep field in particular, in that, you know, with the change in politics and everything else going on between the sleep doctors, the sleep dentists, the surgeons, the ENTs, the pulmonologists, the cardiologists, the neurologists. Who have I left out? The kidney doctors, the metabolic doctors.
Pretty much every system in the body.
Pretty much every system, yeah. So, and as we know, what I've learned through you and through Dr. Gimeno is that with children, we can do early recognition and multidisciplinary interventions. Whereas, you know, when I was a child, you had too many teeth, we had to pull them, which did more damage. And then I grew up in a time where everybody went and got their braces because we had to have straight smiles, and probably because this same orthodontist was using the same technique, everybody where I come from has the same problem now because we all have narrow mouths.
Yeah, the tricky part is it starts with the education, not just the public, but the healthcare provider. And, you know, since it's such a new field, it's not really in any dental school curriculum, but even in medical schools, the amount of training that medical students get in sleep medicine is probably not enough.
Right.
Yeah.
It's the bare minimum. But even a little bit of experience now that I'm so-called a professional patient or whatever you want to call me in that regards, that I've been in the system, that just the fact that the MDs and the dentists, Stanford is the exception. This is not the rule.
It is, and it's actually from what CG created.
Right.
Yeah.
And that's why we need to teach that multidisciplinary, bring that clinic and that dream of his, well, that the orthodontist is there, that the allergist is there, that the mental health doctor is there, or if you need the endocrine doctor or the cardiovascular doctor, because just because you have sleep apnea doesn't mean you're not treating all this other stuff. Now, what we learned and what this data is showing us with the surveys that we did is that once the sleep is managed, all the other stuff, you still have to deal with it, but it's a lot easier to manage.
Yes, I think of it as kind of like this foreboding black cloud that makes any disorder worse. And if you can actually treat the sleep problems or the sleep-related breathing problems, then it's much easier to treat the primary disorder.
And that to me, and getting that education out there, because it's not, when you say, oh, I have sleep apnea, you know, the classic was the white male, the denial, the the obese, I'll just die in my sleep or blah, 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 blah. Whereas now it's, hey, no, you're going to have a heart attack or stroke, or you're going to go to dementia, or you're going to potentially have cancer because you're hypoxic or whatever it might be. And getting that education. When we first started with the ASAA, people used to say, why are you posting about cardiovascular? Why are you posting about diabetes? They don't ask me that anymore. They're starting to understand that it's all connected now. Obviously, out here at Stanford, we get that it's all interdisciplinary and there's a combination here. But the rest of the world and what these surveys are showing us is that there's people are just going in the system being treated.
This issue of multidisciplinary clinic is really, it's fundamental.
Has to be.
And it is not fundamental just because you're talking about sleep. I think it's fundamental for all complex medical issues.
Yes.
So what's so amazing about you and the relationship that you have with Dr. Gimeno and the Stanford department is that you guys do work together. This is a shared decision-making thing. This isn't a paternalistic, maternal, one-way conversation. You're working with the parents, you're working with the children as they grow up, as we spoke with Jackson earlier. And that's unfortunately rare in the rest of this country, now that I don't live in this bubble.
Yeah, I think one other facet that has allowed us to explore other things is there's a lot of cross education amongst us, and so and there's a vibrancy of spirit and a curiosity that if one of us has an idea, then all of us will consider exploring it, and so. There's some things that I can speak in my own office that we'll think about trying, and so we'll try it, and I'll collect data on it. I'll collect photos, and then I'll present it to them.
Right.
And just having that collaboration on then refining the technique or refining the philosophy or targeting something different, that's completely unique. And the dialogue that we have with each other. And I would say it's really having completely being open-minded, because, CG has, he has such imagination. And not only that, he knows the field of medicine so well. He knows all facets. And, he knows neurology, he knows pulmonology, he knows ENT. He actually has a good understanding of orthodontics. And so we can all bounce ideas around. And everybody's input is really
Valued.
It's really valued and it's really heard. Yeah.
You're all behaving like physician scientists, not just playing clinicians. All doing involved in doing some form of research.
Yes, and there's no ego, and so if somebody doesn't have a good idea, and if there's no hesitation to say, maybe that's not going to work, and people don't get offended by it.
So I remember when we first started with my daughter, with Mia, we came here and obviously we had to take out her tonsils and adenoids. So I remember walking in to Peter Koltai's office at Lucille Packard. This is what I'm going to ask you: is 8 years later, has Lucille Packard finally woken up here, or are they still thinking differently than the Stanford Sleep Center? Because Peter's like, oh, when I take your daughter's tonsils and adenoids, that she'll be fine after that. I remember walking post surgery with him to the car. He's like, I guess Dr. Gimeno is right. Her mouth is small. That's why we came to you to do the surgery, and that's why Dr. Gimeno is her sleep doctor.
It's quite fantastic. You actually acted as a primary for her, and the fact that you were the one coordinating all the components of her care. It's hard to find people that will do that, and it's actually hard to find sleep clinics where you'll have one point person. And I found that at Stanford, they'll actually manage care that way.
And what was amazing, even when we met with Dr. Choi, the allergist, she was treating me, and she saw Mia before we even brought her in anywhere. And she looked at the nose and the eyes, and she's like, that child needs to be on Singular immediately. She called Mia's pediatrician in Marin and said, put this child. She's like, well, you haven't seen her. She's like, you can't put children on Singular. She's like, no, you don't understand. You're not up to date. This child needs to be on Singular yesterday. Okay, these now finally, after my whole life, I'm with doctors that, one, get it, they know what they're talking about, and they're doing something about it. So I don't know where we left off, Jill.
I don't know. I'm just a technician.
Yeah, you
guys are a good team. Yeah,
he's been a great mentor. I've had a few in the last few years as I've grown. You saw what I looked like when I first walked in this place.
You look fantastic. I mean, you look happy. You've got a shine in your eye. You've got a glint in
Thank
your
you.
eye. Yeah.
That I have. And I feel good that way. But I honestly, 10 years, 8 years later, now that Mia's treated, I didn't know I was going to see her even grow up. That's how negative outlook in my life was. So just going to Florida, I wanted, to get to breathe, to live,
Mm-hmm.
and just to then wind up profoundly living across from Siesta Key, and then to start, building up. Not that I wanted to be running the Patient Advocacy Association, but I wanted to start telling her story, my story.
Looks what it snowball became. Yeah. Yeah. Very
It's-
powerful.
It's
Very
It's
powerful.
not what I grew up to be, but as a storyteller, as a filmmaker, now I know the stories I'm supposed to be telling.
Now you can distill it down, make it a very compact.
Because I've never shared with all of you, but my first student film at 22 years old was the euthanasia film. That's how negative I was.
Wow.
I wrote that the day I found out my dad was diagnosed with early onset Alzheimer's in those days.
Oh, goodness.
So that's, I partied hard, I played hard, and I did everything because I didn't think I was living long. I thought my dad had Alzheimer's at 50. What is it? I was scared to even have a child. Having me has saved my life, in all honesty.
Wow.
So
That child is a gift.
she's been a gift. She's an only child. She's a bit of a brat, but in a good way. She can have it. She's got my mouth. Unfortunately, I'll let everyone else deal with that later on down the road.
You should talk to CG and talk to Casey about doing TPD.
Yeah,
I
remember years ago you were telling me you should go have it. Anita was saying the same thing.
But now it's different.
Now it's different.
Now it's different. It's for adults. It's not just the expander. It's a combination of the design of the expander and the technique.
And it's going to help with this too, and how crowded I am bunched down here.
You would need some amount of orthodontics with that, but the amount that it can reduce the nasal resistance, that would be the primary reason to do it.
The things that are giant in my mouth, and you haven't looked at my mouth, what are the
Oh, you have tori.
gigantic.
Oh.
And I know, and then they're right where I'm white on my beard.
Oh.
And I know they're related. Somehow I know, whether it's from all the years of grinding or whatever it is.
There is a relationship with the size of the tori and bruxism. Yeah.
It has to be.
Yeah. I think probably the group here is different from other groups in the fact that they're, and it's really, the tone has clearly been set by CG to see if we can change somebody's trajectory.
Let me ask you a question. Who's the next CG? It's a good question, right?
That's a very good question. Yeah.
I don't know the answer yet.
Yeah.
I haven't found it.
There's definitely many shining stars.
Okay.
Definitely. But I think it's going to be hard to find somebody with his level of expertise and his level of commitment.
Right.
He
just got to meet him for the first time as a Frenchman, and I dragged him into Will's appointment. I said, I want you to see him. So I want you to see the character that this is.
Oh, and he loves all things French, so I'm sure he immediately took to you.
No, he saw me. He wanted to run the other way.
Enchanté, and he responded in English. I'm not speaking to you in French.
Really?
Yeah.
Well, he knows from your name, Gilles, right? So, yeah.
He's such a character. I'm dying to make his portrait because you can see in his eyes. You can see this.
Oh, he's brilliant, and not only that, his commitment to the patient is unlike anyone you'll see.
Total lack of BS.
Yes, he doesn't.
A brutal lack of it.
Well, that's because he was in the room with me and he knew.
the way he responded to some of what Will has been told by other doctors, you can see it's.
Oh, and he doesn't. He tells it like it is. He doesn't hesitate to pull punches.
Well,
and because he's such a patient advocate, if he really feels like a patient is getting incorrect treatment, he won't hesitate to tell him. If he thinks he could be seen by a better provider, he'll tell the patient. Yeah. So, I mean, his first and foremost passion is really to help the patient.